So this video is cranial nerve number 1, olfactory. I already washed my hands and I'm going to instruct the patient to, I will compress each of his nostril and let him sniff. When I close it, sniff, okay? Now this time I want you to close your eyes and I'm going to let you guess what are you smelling. Hold on.
Smells like cinnamon. Cinnamon.
Okay, this one I'm going to test for cranial nerve number 2, the optic. So I'm gonna first check the patient's acuity. Can you demonstrate to me how can you clearly read this book that I'm giving you, that I gave you?
So move
Yes.
it until I can read it.
Yeah, just maybe a few words.
I can't read it.
Okay, so you need glasses. Now I'm gonna test for visual fields. Just look at me and if you can see my hand on the side.
Yes.
Alright. Okay. Now I'm going to inspect the optic funda. I'm going to use otoscope. I'll inspect the size and shape of the pupils and compare one side with the other. Okay. Alright, now I will test the mirror reaction. Thank you. 1.3 ratio caliber arteries to vein, absence of, there is no papilledema, no enlargement or cup enlargement. Pupils constrict upon a far object to a near object. Okay, this time I'm going to record cranial nerves 3, 4, and 6. Mr. Downing, I want you to follow my finger without moving your head. Awesome. Okay, this time I'm going to test the cranial nerve number 5, trigeminal, and this is the first part, the motor and sensory. So I'm going to instruct the patient to clench your teeth. Clench your teeth. Open it, and then move your jaw side to side. Okay, very good. Now, I want you to close your eyes, okay? And I'm going to use a Q-tip. One has a soft edge and one has a sharp edge. You have to let me know which one is sharp and which one is soft.
Soft. Sharp. Soft. Sharp. Soft. Soft. Sharp. Sharp.
Okay, now I'm going to test the corneal reflex. So I'm going to ask you to look up and away from me and approach from the opposite side, which I'm going to be here, out of the patient's line of vision, and I will avoid your eyelashes. So what I'm going to do is I will lightly touch the cornea, not the conjunctiva, with this fine whisked cotton. So I will know if you will blink or not blink. It's going to tell me. The normal is look straight here, not up. Good. Okay, blink. So normal corneal reflex or normal reaction to the stimulus. So this time I'm going to check for the cranial nerve 7, the facial. So I'm going to inspect your face, both at rest and while we're talking. Can you tell me your name?
Jeff Downing.
Okay. And I have to note for any asymmetry. So no. Can you raise both of your eyebrows? Make a frown face. Close both eyes tightly so that you cannot open them. Let me try. Okay. Good. Open it. So your muscular strength in your face is good. Ask the patient to show both upper and lower teeth. And smile. And puff both of cheek. Of both. Okay. Now, do this to your neck. Or do you want to see it? Okay. Normal facial muscular strength. Thank you. Now we're gonna do the cranial nerve number 8, acoustic and vestibular. We're gonna do the acoustic first. So what I'm gonna do is I have to assess your hearing with the whispered voice test. So I'm gonna ask you to repeat the words or numbers that I'm going to whisper into one ear while I'm blocking or rubbing your other ear next to the contralateral ear.
I love you.
But the other one.
Chicken dog.
So what I'm gonna do is a continuation of the cranial nerve 8, the Weber's test and the Renee's test. So let me know if this is the same as in your ear.
Yes.
And then here.
Yes.
So this time I'm going to check for cranial nerve 9 and 10, the glossopharyngeal and vagus. As I listen to your voice, I have to identify if there's any hoarseness and the quality of your nasal. First, I just want to ask if you have difficulty of swallowing.
No.
Now I want you to say "I" as I watch the movement of your soft palate and the pharynx. And I'm going to use the tongue depressor. Say "ah" first. I'm going to use the tongue depressor. Alright. Thank you. Normally rises symmetrically. The uvulva remains in the midline and each side of the posterior pharynx moves medically like a curtain. There's no redness either. So this one is the cranial nerve number 11, the spinal accessory. So I'm going to stand behind you and I will look for any atrophy or fasciculations in your trapezius muscle. And then I have to compare it. Now what I want you to do is to shrug both of your shoulders upward against my hands. Okay. All right. Thank you. Now I'm going to ask you to turn your head to each side against my hand. You're strong. You're strong. Hard. So there is absence of atrophy and fasciculations in the trapezius muscles and noted with normal head and neck strength. It's very strong, obviously. So this time I'm going to check the cranial nerve number 12, the hypoglossal. So I'm going to inspect your tongue as it lies on the floor of your mouth. So definitely you have to open your mouth. Okay. Now I have to look for any atrophy. Continue to open it. Atrophy and fasciculation. Look, I'm going to look for any asymmetry, deviation in the midline. Can you move your, and I'm going to use the tongue depressor. Okay. Very good. Now move your tongue from side to side so I can note for any asymmetry. Very good. Now push your tongue against the inside of each cheek in turn as I palpate the external for strength. Awesome. One more. Okay. Your tongue is symmetrical and demonstrate good strength. Alright, this time I'm going to test for the motor system. We're going to do the muscle bulk first. I'm going to inspect the size and contours of your muscles to see if you have any atrophy and if your muscles are in concave shape. Now I need to pay attention to your hands, to your legs. Now, let me focus to the hand and see if you have any atrophy. Okay, so we're gonna do the muscle tone test, and this is assessed by feeling the muscle resistance to passive stretch. So I just want you to relax, and what I'm gonna do is I'm gonna hold one hand with yours, and while supporting the elbow, flex and extend your fingers, wrist and elbow, and the shoulder through the moderate range of motion. We're gonna do that first, and then after that, I'm going to test your muscle tone in your legs. Okay, just relax. Okay. Side. Very good. Okay, this time I'm going to test the muscle tones of your legs as I flex the knees of your legs. Okay. Very good. Okay, I'm gonna test your muscle strength. Do this and kind of resist my hand the way when I push it. Okay, other one. Very good. Okay, this time we're going to test your coordination, and I will observe first is the performing rapid alternating movements. So I will show you how to strike one hand on the thigh, raise the hand, turn it over, and then strike the back of the hand down on the same place, and then repeat alternating movements rapidly as possible. We're going to do that first. Do it. No. Now, this time, to tap the distal point of the thumb with the tip of your index finger. And again, repeat it as rapidly as possible. Very good. But the other one. Awesome. Now with your legs, I'm going to ask you to tap the ball of each foot in turn as quickly as possible on your hand or the floor.
You would do the floor?
You can do it here. Okay.
The ball.
Yeah. The other one. Okay. Very good. Normal leg coordination. Now this time we're going to do the finger to nose test. So I'm going to ask you to touch your index finger, and then your nose alternately several times. And then I'm going to move my finger so that you can change. I will change the direction, and you will change the direction too. And extend the arm fully to reach out my finger. Okay? Very good. Now, hold your finger in one place so that the patient can touch it with one arm and the finger outstretched. Now I'm gonna ask you to raise the arm overhead and lower it again to touch my finger. Right. Try to close your eyes. Very good. Noted with accuracy and smoothness of movement. No tremors noted, and the patient demonstrated successful touch of the examiner's fingers while eyes were closed. Now let's do the legs heel to chin test. Ask the patient to place one heel on the opposite knee, okay, then run it down the shin to the big toe. Repetition with the patient's eyes closed. Test for position sense. How about the other side? Very good. Thank you. Okay, this time we're gonna test for the gait. I want you to walk across the room and then come back. Turn and come back. Okay, now walk heel to toe in a straight line or tandem walking. Very good. Now walk on your toes. Then walk on your heels to test the plantar flexion and dorsiflexion of the ankles as well as the balance. Now come here. I want you to hop in place on each foot in turn. Other one. Now do a shallow knee bend. First one leg slowly and then the other. All right. Now you're gonna need a chair or a stool. Alternatively, rise from a sitting position without arm support and step up on a sturdy stool. Okay, thank you. So patient is noted with intact posture, balance, swinging of arms, and movements of the legs. So we're gonna do the Romberg's test and then the test for pronator drift. First is the Romberg's test. What I want you to do is stand with feet together, eyes open, and then close both eyes for 30 to 60 seconds without support. Okay, now for keep standing and for 20 to 30 seconds with eyes closed still, both arms are held straight forward with palms up, okay, and then keep your arms out and eyes shut, still closed, and tap the arms briskly downward. So for 30 seconds. 6, 7, 8, 9, 10. Very good. Patient noted with the ability to maintain upright posture, noted with normal swing of arms. Patient demonstrated ability to hold his arms while eyes are closed. Demonstrated good muscular strength coordination and good position sense. Okay, this time we're going to test the sensory system, beginning with a test for the pain. So I'm going to use a sharp safety object, which is this Q-tips with a sharp edge on the one side, and occasionally I will blunt the end of this point, and I'm going to ask if it's sharp or dull. And then of course I already observed for infection control. So this is how it feels when it's dull, and then this is pain. I want you to close your eyes. I'm going to start on the arms.
Okay.
Is it pain? Sharp?
It's the sharp end. Soft. Soft. Pokey. Soft. Pokey. Pokey. Soft. Soft. Pokey. Soft. Pokey.
Thank you. Okay, this time we're going to test the temperature. I have two items here. One is hot and one is cold. So this is how the hot feels like, and this is the cold feels like. Okay. So tell me if it's hot or cold.
Hot. Cold. Cold. Hot. 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 Cold. Cold.
All right, very good. Thank you. Okay, this time we're gonna test for vibration sense. Use a relatively low pitch tuning fork of 129 hertz. I'm gonna tap this fork on the heel of my hand and place it firmly over the distal interphalangeal joint of the patient's finger, then over the interphalangeal joint of the big toe. And I'm gonna ask the patient when the vibration stops. Okay? Move your finger. Can you feel the vibration?
Yes.
How about here?
Yes. Yes.
Here.
Yes.
Okay, thank you. Now we're gonna do the light touch. So using the fine wisp of cotton, I will touch your skin lightly, but of course no pressure. And you need to respond to me whenever a touch is felt. Just say to compare one area with another.
Now. 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 Now.
All right. Thank you. Okay, this time we're gonna do the discriminative sensation. Before you close your eyes, I'm gonna show you. This is a paper clip. It has two sharp edges. So I'm gonna touch your fingers, okay, and then let me know if it is 1 point or 2 points. Okay. That is called discriminative sensation. Close your eyes.
1, 2, 2, 1, 1, 2.
Okay, very good. You are able to identify which is 1 and 2. Okay, now we're gonna go and test the deep tendon reflexes beginning at the biceps. So the patient's elbow should be partially flexed and the forearm pronated with palm down. Place your thumb or finger firmly on the biceps tendon, okay? And I'm gonna strike it with a reflex hammer, okay, directly through your digit to my digit toward the bicep tendon, because I need to feel the contraction of your muscle. Okay, now we're gonna test the tricep reflex. So while you are sitting in a position, flex the patient's arm at the elbows with palm toward the body and pull it slightly across the chest. Strike the tricep, which I'm gonna do it, tendons with the direct blow directly behind and just above the elbow. Watch for the contraction of the tricep muscle and extension at the elbow. So I'm going to demonstrate it now. I'm going to watch for the contraction of your tricep. Ooh. Visible. Thank you. Okay, now we're going to test for brachioradialis reflex. So keep your hands rest at your lap with the forearm partly pronated, and I will strike the radius with the point or flat edge of my flex hammer for about 1 or 2 inches above the wrist. Then I'm going to watch for flexion and supination of forearm. This way. Okay, see it. Thank you. Okay, this time I'm going to test the patellar reflex or the quadriceps reflex. Since you are sitting and your knees is flexed, it is really good position. I will briskly tap the patellar tendon just below your patella. So this is your patella, just below here. And I will note for any contraction of the quadriceps or quadriceps extension at the knee. Okay. So I want you to relax. I have to place my hand here. Okay, very good. The other side. Very good. Awesome. Thank you. Okay, this time I'm going to test the Achilles or ankles reflex. So relax. And I'm going to strike the Achilles tendon and have to watch and feel for plantar flexion at the ankle. And I will note the speed of relaxation after muscular contraction. Oh, thank you. Wait, can we move? Hold on. I need to move a little bit here. Thank you. The other side. Okay. Good. Thank you. Okay, this one we're going to test the clonus. So support the knee in partly flexed position with your hand, dorsiflex and plantar flex the foot few times while you are relaxing. Okay, continue to relax. Then sharply dorsiflex the foot and maintain the dorsiflexion. And then I will look and feel for rhythmic oscillations between dorsiflexion and plantar flexion. Okay. Now I'm going to flex and dorsiflex. Feel it?